Good morning. Thank you. Nalini was much nicer than I am. I'm going to get you guys engaged. So my name is Jon Mark Hirshon. I'm a professor at University of Maryland. And I'm going to talk very briefly, because we have 4 presenters in a short period of time. So I'm going to talk relatively quickly about our program in Egypt, injury prevention research training in Egypt and the Middle East. Okay, so I'll talk quick about the history, a little bit about accomplishments, and also some of the lessons that we've learned. So one of the reasons why we focus on injuries is that there's a substantial burden globally, and roughly 6 million people every year are killed, and that's from intentional and unintentional injuries. And 90% of those deaths occur in lower and middle income countries. Okay. In addition to a substantial burden, there's a significant amount of equity issue here. So the poor are the most vulnerable. So someone who's working, and I have these incredibly graphic and terrible pictures of folks in Sudan who work grinding meat in the market, and they've got these meat grinders, okay? Well, they're not electronic, but they make them electronic, okay? So they put the meat through so it can grind it. And then they really should use something tampered, but they use their hands, and their hands will end up going through these meat grinders. If they're the primary breadwinner, they've just lost function of their dominant hand, and that, not only them, but their whole family is now impacted. They're going to have difficulty accessing care because to get someplace where they can get care, they're going to have to be able to pay for it. And then there's really inadequate rehab for them as well. So it disproportionately impacts people who have less. It's a social equity issue as well as a substantial burden. Okay, and the area that I work in is primarily the Middle East, Egypt, Sudan. We've done training and have trained people from the whole region, but primarily Egypt and Sudan. Okay, and the reason we focus on this area is because if you look at WHO in the different regions, the Middle Eastern region has some of the highest. This is just road traffic fatalities, but except for the middle income countries, you can see for high income countries and for low income countries, there's a substantial burden in the Middle East. So from a historical perspective, Fogarty in 2004 put out a request for grant applications, and this was to establish research training programs that contribute to the capacity of developing country investigators and institutions to conduct human trauma and injury research relevant to the health needs of the developing country. So even though it's directed, primarily Americans will be applying for these grants, it's really to develop the capacity, to develop the relationships, as Nalini said, related to U.S. capacity for injury and developing that, injury research and developing that capacity in the developing country. And so that's really how our program started, and we've been doing it since 2005. Lots of stories. I know Junaid and I have, we could tell you lots of interesting stories, and some of them are lessons learned, shall we say. When you put together a grant application, it has to be clear what you're trying to achieve. Okay, so you have to have your program objectives. Here, it's to train healthcare professionals on injury research and the clinical care of the injured, to expand research and training opportunities for injury-related research in Egypt and the Middle East, and to emphasize the public health and clinical importance of acute care, and to develop sustainable injury research programs. So, there's always a little bit of a challenge with this stuff. Fogarty and NIH wants research training. Okay, when you arrive in the country, research is not their priority. It's how do we take better care of the patients. And so because of this, we recognize that there's a little bit of a schizophrenia, and we'll talk a little bit about how we address that. Okay. So again, from a very pragmatic perspective, what do we see? When I go to the Middle East, people often ask me, well, isn't it dangerous to go to the Middle East? I say the most dangerous thing I do when I go to Cairo, cross the street, okay? If you take a look here, here's a person trying to cross the street, okay? There's no zebra, there's no stop, you just a little duck and weave. If you want to take public transport, there you go. But the one that bothers me the most is this one. And why is that? That's the future of Egypt, okay? That little kid in an open car without a seatbelt, they get into a minor fender bender, the kid goes flying, and that kid is disabled or killed for the rest of their life. Okay? These are the things that we're trying to address, okay? But there are challenges, and I think without belaboring this, for me, one of the biggest challenges has been in Egypt and the Middle East has been societal instability. If you guys haven't noticed, it's a little bit of a rough neighborhood. And even in Egypt, which is a relatively stable country, we've had the Arab Spring followed by it's been a challenging 5 years. So in order to address the kind of two different programs, two different perspectives, we developed a short course, Injury Epidemiology, which was originally a two-week in-person course, and now we've done an online blended version. And we've trained people from throughout the region, Iran, Iraq, from Palestine, from Sudan, from a number of different countries. And then we also developed a short sequential trauma educations program. So this is kind of our clinical how to take care of trauma patients for folks who don't know how to take care of trauma patients. And it's similar to ATLS, but different in that it's flexible, adaptable, and we can adjust it based on the needs of the country. Now, that's not exactly what Fogarty wants. That's what the folks in Egypt want. But at the same time, if you want legitimacy, you have to be able to I don't go there to say, look, this is what I think you need to do. I go there and say, what is it that we can help you with? Okay? And if this is something they need help with, then we can develop that structure so that that way, when we've done this enough times, and this is what's happening in Sudan for us, we've given the course 3 or 4 times, we're starting to go. We now have someone who's been trained through our course and starting to get junior people to do injury-related research. So we're developing that relationship, we're developing that infrastructure, which is what this is all about. So we have a short course, and this is one of the graduations. We have our longer course, which they come to the U.S. for 6 to 8 weeks. We teach them, they develop a project, we teach them how to do research, then they go back and they're supposed to implement that over the next 12 to 18 months. This is when we were presenting one of our groups at the NIH, a STEPS program I talked about. And I'm going to fly through because I know that we're short on time. So we trained probably over 1,200, because again, metrics are very important. NIH likes publications, they want to see grants, etc. But at the same time, who have you reached? So through our short courses, we've probably trained at least 1,200 people from many different countries in the region. We've had at least 70 people come through our summer course to go back and do research. Now, have all of them been successful? No, but a number of them have gone on to do their masters or doctorates. A number of them have done research projects. One of our early trainers is now the advisor to the Minister of Higher Education. So we've seen that growth in that relationship. So let me say, what have we learned? What we've learned is that, first of all, allow adequate time for planning. When I teach young people to do research, they say, well, I'm going to accomplish this in 6 months. I said, well, okay, that's great, so double the time. Okay? When trying to put together a program, you want to have enough time to have that conversation. You want to be flexible. Again, we could go through lots of stories. We won't do that right now. Allow adequate time for discussion. Be culturally sensitive. You're learning from both sides. It's not just you coming, but it's really a relationship. Okay? Identifying key partners is critical. This is all about the relationship building and helping them to develop what they need for their country. And, in the end, enjoy it, because it's a lot of fun. It's amazing, the journey that this has allowed me to go through. So, in the end, we have an old African proverb we like to say, which is, if you want to go fast, you go alone. But if you want to go far, you go together. And there are many different folks that have been involved in this process, many different collaborators, and that's why we've been able to continue, thankfully with the support of Fogarty, to be able to continue this journey for as long as we have. With that, I'm going to stop and turn it over to Junaid, and thank you for your attention.